Do your neck muscles get sore, stiff, or achy at the end of the day? Maybe it's after working at a computer for a long period of time, or spending a lot of time on your tablet or smartphone. Or maybe you just feel like when you're stressed, your shoulders get really heavy, like you're literally carrying the weight of the world on your shoulders. If any of these apply to you, then I'm going to show you a really simple, easy, and free way to release knots in your neck and shoulder muscles. And the great thing is that physical therapists, massage therapists, and chiropractors often pay hundreds or even thousands of dollars to learn these kind of techniques. But I'm going to teach them to you for free. And all I ask is that if you get value out of this video, then please share it with someone else so they can get that value as well. So let's get started. If you don't know me, I'm Dr. Dave Candy, owner of More for Life here in St. Louis, Missouri. But we help people throughout the world with our YouTube videos. And in this particular video, I want to show you what's called myofascial release technique. And myo meaning muscle, fascial meaning the envelope that surrounds muscle. Now, before you understand how this technique works, you really need to understand a little bit about what causes muscle knots in the first place. And muscle knots, the medical term for them is trigger points. It's where the little fibers in a muscle, when your muscle expands, those fibers separate, and when it contracts, they kind of ratchet together. But in a trigger point, you get a lot of little knots where those ratchets kind of get stuck together and they won't relax. And so the goal of myofascial release is to release those knots or those ratchet-like adhesions inside a muscle so that the muscle lets go. Now, a lot of people will do this with either massage guns or trigger point balls or all kinds of other various devices where they just beat the heck out of the muscle until it's sore. And that does sometimes feel good because that pain that you cause releases opioids into your body, and it feels good for a short period, and it feels really good when you stop. But it doesn't really fix or release the muscle necessarily. So what do you need to do to actually be able to release the knot in the muscle? Well, there are two different types of receptors that you have in muscles that regulate the tone or the tension in a muscle. One of them is called the muscle spindle. And what that responds to is length or stretch. If you think about when you go to the doctor and they hit your knee with the hammer, that quickly stretches the tendon in your quadricep muscle. And what happens as a result is you get that knee jerk reflex. Well, when you activate the muscle spindle, it makes the muscle tighten or tense up. And so you don't want to activate the muscle spindle when you're trying to release a muscle. Contrarily, you have another receptor called the Golgi tendon organ. And what that responds to is tension. So when a muscle is under tension or it has pressure applied to it, then that Golgi tendon organ inhibits the muscle, makes it relax in order to prevent injury to that muscle. And so what we want to do with this technique is activate the Golgi tendon organ, or GTO for short, without causing pain and without activating that contractile protective reflex. And so to do that, you want to first find the trigger point in your muscles. And the most common muscles you'll find trigger points in the neck are the upper trapezius, one that runs diagonally down this way, looks trapezoid-like. And then the other one is the levator scapula. It runs from the top part of your shoulder blade. If you feel around and feel like a bump on the top of your shoulder blade, and then you draw a diagonal up to your neck, that's the levator scapula. Now, to find a trigger point, you want to picture the fiber directions, and you can see those in the pictures here of the levator scapula and the upper trapezius. And to find them, you want to go perpendicular to the fibers. So if the fibers are running this direction, you want to go across them this way. That's the easiest way to pick up adhesions or knots in the muscles. And so if we're looking at the upper trapezius here, the fibers run in this direction. And so you want to go across those fibers, kind of pinch the muscle and run your fingers across. Now, you don't really want to slide on the skin. It's really more, it looks more like this in real life, but you can't see that. What I'm kind of doing is sliding my fingers slowly across those muscle fibers until I find an area where it feels tense. And not necessarily painful, although it probably will be a little bit painful, but you also want to feel where you feel like a bundle or a knot underneath your fingers. And then once you find a general area where it's sore and knotted both, then you want to kind of hone it in and find the most knotted, most sore spot until you can kind of pinch it between two fingers. Now, realistically, there will probably be several of those. The upper trapezius is a pretty big muscle, so you'll have to explore the whole length of the muscle from the bottom up to the top, and you may have to treat several different areas. But you'll go along, and then you want to get it ultimately down to just where you can find the absolute epicenter of the trigger point, where it's the most tight and the most sore. And that's where you're going to get your best treatment effect if you can be specific. So it's not about just beating the crud out of the muscle. It's about finding the area where you're going to get the best effect. And then once you find that super tender, super knotted spot in the muscle, try to pinch it between your thumb and your middle finger, your thumb and your index finger, or you may use them both, and try to localize down to that area. Then once you find it, then you want to back off and let some pressure off so that you're just barely pressing on that area enough that you can just slightly feel that it's a little bit sore. Now you have to be patient, and you just hold that pressure on that trigger point for 60 to 90 seconds. And you may have to do it even longer than that. But essentially, you want to hold a gentle pressure on that area to activate the Golgi tendon organ, or GTO, without getting a protective reflex. And so it's important to not put too much pressure. So this isn't going to feel like, oh, it's that good pain, it just hurts so good. But it's going to be more effective in the long term. So you find that really tender spot, and then you just let your fingers kind of sink in. If you picture putting your finger on an ice cube or putting your finger on a stick of butter, you should just feel that trigger point slowly, and it will be slowly, melt away underneath your fingers. So you don't get that immediate gratification of, oh, it hurts so good, but you will get a better effect over time. And then you hold the one point for, again, 90 seconds or so, and then move to another point, and move to another point, and move to another point. And so that's your upper trapezius. Now, for your levator scapula, that technique is fairly the same, but the location is a little bit different. So again, the most tender spot is usually right on the base of the shoulder, right there. So you've got your spine of your scapula or your shoulder blade, and that comes out this way. If you work your way up, you'll find the top part of the scapula or the superior angle up there. And then once you find that superior angle, you want to, again, move around until you find the most tender spot. So again, specificity is much better. The more specific you can be with your palpation or your feeling, the more effective you're going to be with your treatment. Find the most tender, knotted spot, and then hold the pressure down. Now, this isn't dig in as hard as you can again. It's a very gentle pressure, and then just hold that pressure for a long period of time, minute and a half or so. And then you can work your way up diagonally along the levator scapula. This is a little bit harder to feel on yourself. So start out with the upper trapezius, go to the superior angle of the scapula to find your levator scapula. And so those are two really great ways to release tension in knots in your muscles. And it doesn't hurt your fingers all that much because you're not pressing all that hard. So again, this is more of a finesse technique. It's not a brute force technique. Ultimately, though, something did cause those knots to come on in the first place. And if you don't address that, they're going to keep coming back. A lot of times those are postural problems like sitting with a forward head at a desk, not using your armrests when you're working at a computer, looking down at your tablet or smartphone for too long, but they can also be repetitive force factors. For example, if you always carry a purse over one shoulder, or you always carry a bag or a briefcase in one hand, over time, that can push the shoulder down on one side and actually lengthen the muscle. Now, often people will try to stretch knotted or stiff muscles, and sometimes that's a good solution. But you can also develop knots or sore muscles from the muscle being posturally lengthened, where it's stretched for a long period of time. Now, when I treat patients clinically with myofascial release type techniques, I'll notice that they have knots usually on both sides, but a lot of times the side that is more tender or more sore to them is not the side that feels tighter and stiffer, because it's much more common to have a sore muscle that's been overstretched rather than one that's tight. It's not always that way. Sometimes the tight one is the sore side, but it's more common actually for the overstretched side to be the one that's really tender and tight and feels knotted. So you don't want to stretch it in that case. An easy way to tell if you're just doing this at home is to look in the mirror and see if one shoulder is lower than the other. And if that shoulder is your painful shoulder, then you don't want to stretch the painful side. It's actually more helpful to reach your arms up in the air and stretch up towards the ceiling so that you shorten that overstretched muscle, or bring the overstretched arm up in the air and reach it up in the air so that you stretch the muscles underneath the shoulder blade that are pulling that muscle down. So again, you don't necessarily always need to stretch a muscle that is sore, and sometimes stretching it will make it worse. Now, if the sore side is the one that is higher up, then stretch away, kind of like people always stretch their neck muscles, either just tipping your head over or putting a very slight gentle overpressure on with the other hand and holding for 60 seconds or so. So those were some tips to help you release knots in your shoulder muscles, a few tips to help you understand the root causes and things you can do to address those. But ultimately, if you are having persistent neck pain, it is a good idea to get it addressed in person by a healthcare professional. And if you are in the St. Louis area, we'd be happy to help you out here at More for Life. And again, if you're watching this from somewhere else and you found it helpful, hit the share button below and share it with someone else so they can get help from it as well. And if you do want more information from me, I do have a book available on Amazon called Chronic Pain. You're not just getting older, you're not crazy, and it's not all in your head. So thank you so much for watching, and I'll see you in the next video.